Throughout the week as we approach the 20th anniversary of 9/11, Arizona PBS is featuring stories that reflect on that tragic day and how it changed our lives. Today, Cronkite News reporter Kamilah Williams takes a look at federal health program providing treatment for conditions related to the attacks.
It's been 20 years since the terror attacks in New York, Pennsylvania, and Washington, D.C. Survivors, first responders, and family members will forever be impacted by that tragic day. One program is trying to address the lingering physical and emotional effects, not just in New York, but all across the United States. A day none of us will ever forget, but hard for many to process.
He doesn't speak about it.
Juan Angulo was just 10 years old and living in New York when the Twin Towers fell. His cousin worked across the street from Ground Zero and has struggled with his memories from that day.
Not because of his experience, more of what he saw, like dead people on the floor and the fact that he couldn't help because he himself was like trying to get away from the situation.
Angulo says in the Hispanic community, talking about emotional or tragic situations can be hard, but he believes sharing makes it easier to cope.
Like even I getting counseling from school was something that my dad didn't approve.
The World Trade Center Health Program offers help to those who lived through that day, providing screenings and treatment to first responders, survivors, and people who worked or lived near the site of the 3 attacks.
We encourage people who were in the disaster area in New York City or at the Pentagon or Shanksville to reach out to the program.
Brittany Rizik is the deputy director for the program. Many of the services offered relate to illnesses caused by toxins from dust and debris. Others focus on PTSD, depression, and anxiety.
We have 112,000 members who receive medical monitoring and healthcare treatment.
When the pandemic started, services were altered to meet the needs of its members.
We very quickly put into place policies and procedures to permit telehealth.
Those who live outside of the New York metropolitan area can use the nationwide provider network to find a clinic. While the program is authorized through the year 2090, Risnik says more people continue to be enrolled, and that includes patients in Arizona. Here in this state, there are anywhere from 100 to about 500 people being treated through the program. Across the nation, enrollment has steadily grown for first responders alone. Enrollment went from about 79,000 in June of 2020 to over 81,000 a year later. If you or someone you know was impacted by the 9/11 attacks, you can go to www.cdc.gov/WTC. At the Google touchscreen, Kamilah Williams, Cronkite News.